Communications Manager for the County of Sonoma, and this is our health update for Tuesday, November 15th. Let's begin with a brief message from Julie, our Spanish interpreter, for our Spanish-speaking viewers. Julie?
Thank you, Paul. Muy buenas tardes y bienvenidos a la sesión informativa de Salud Pública. Esta reunión informativa es para actualizar al público sobre las enfermedades respiratorias y otros problemas de salud. Si está participando por Zoom y quiere escuchar la presentación en español, busque y oprima el icono del globo que se encuentra al pie de la página que indica interpretación y seleccione el idioma español. Para los que estén participando por Facebook, pueden escuchar la interpretación en español en el canal de YouTube del condado. Para escuchar la versión en español, puede utilizar el enlace de YouTube que se encuentra en la página de Facebook del condado de Sonoma. Muchas gracias. Back to you, Paul.
Thank you, Julia. Hey, so the purpose of our update today is to discuss the rising number of respiratory illness cases that we are seeing occurring here in Sonoma County. As many of you are aware, school children are staying home sick at a very high rate, and many adults are missing work due to respiratory infections. Some of this is certainly due to new variants of COVID-19, which is still circulating in our community, not as more severely as it once was, but it's still out there. But we are also seeing increased levels of influenza, RSV, and other respiratory viruses. These airborne diseases are spread in similar ways as COVID, and there are preventative measures that we can take to lessen their impact, and we're going to cover those today. We're also
I'm
going
sorry to interrupt, Paul. The interpretation feature hasn't been activated yet.
Thank you all. We apologize for that interruption, but we wanted to make sure our language interpretation is working. So anyway, as I was saying, we are seeing a rising number of respiratory illness cases in our community, and we're going to hear today about some of the preventative measures that we can take, some of which are very familiar to us, given all that we learned during the COVID pandemic. We may have fallen out of practice with some of these steps, but some of them are very basic, like washing our hands, wearing masks, and especially staying home when sick. All those steps would go far in preventing the spread of the respiratory infections. We also want to talk today about the importance of getting a flu vaccination, of course, as well as getting the COVID booster shot if you haven't gotten one already. To go into more of that, we're joined today by Dr. Sundari Mase, Sonoma County's health officer. After her presentation, we'll hear from Kate Pack, Sonoma County's chief epidemiologist. And then we'll hear from two leading medical experts in our community. These include Dr. Gary Green, an infectious disease expert with Sutter Health, and Dr. Jenny Fish, a family medicine physician from a community health center here in Santa Rosa. And after that, we will have an opportunity for those of you, our viewers, to ask questions of our panelists. If you have a question you'd like to submit, you're welcome to post it in the Q&A box at the bottom of your screen if you've registered for this webinar. You're also invited to submit it to public affairs, one word, at sonoma-county.org. That's public affairs at sonoma-county.org. And if you're following us on social media where this is being streamed live, you also are invited to leave your question in the comments area there on Facebook or YouTube. But let's get started with Dr. Mase for an update on COVID and where we are with some of these other respiratory illnesses. Dr. Mase?
Great. Thank you so much, Paul. As Paul just mentioned, we are seeing a concerning increase in respiratory illnesses this fall. Flu and RSV, respiratory syncytial virus, are especially prevalent. There is some good news, however. Overall, our COVID case rate is the lowest we've seen at this time of the year. However, we are seeing some signs that cases are starting to tick up. Given that we have seen the surge in COVID cases in Europe and on the East Coast, we're concerned that it could happen here too. In the coming weeks, as people gather indoors to celebrate the holidays, we are already seeing an increase in hospitalizations due to the flu. For these reasons, I strongly encourage everyone to get their influenza vaccine, or more commonly known as the flu shot, and their COVID bivalent booster now before the holidays. This is the best step that we can take to keep ourselves, our families, and the community healthy. There are, of course, other things that you can do individually to reduce the spread of respiratory diseases in our community. At the same time, reduce the chance that you will come down with a life-threatening illness that could put you in the hospital or a family member in the hospital. These guidelines have not changed since the beginning of the pandemic. I strongly encourage everyone to continue wearing masks in indoor public settings with large groups of people gathered close together. This is especially important to protect those who are elderly and who are immunocompromised. High-quality surgical or N95 masks are still strongly recommended, and it's important that we celebrate safely. If you're sick, please stay home and don't go to gatherings, don't spread it to other people. I also continue to encourage you to get tested if you have symptoms or have been exposed to a COVID positive person. If you test positive on an at-home antigen test, follow all the precautions, staying at home, but also report the results to the county by going to the county's website at socoemergency.org and finding the COVID testing page. At the top of that page, you will find a link to a form for self-reporting your at-home antigen testing results. This important step will help us and the public better understand how quickly COVID is spreading in our community and the numbers of cases that we have. Again, the most important thing you can do is to get vaccinated against COVID. Get your booster shot if you're eligible, and also get a flu shot. The COVID vaccine is now available for anyone 6 months and older. That's the bivalent booster, and it's available. That is, the COVID vaccine is for anyone 6 months and older. The booster, the new bivalent booster, is available for anyone 5 years and older who's at least 2 months past their last COVID shot. You can find a COVID booster through your primary healthcare provider or most pharmacies. You can also get one at the vaccine clinic in Roseland and at the Roanoke Park Community Center. Many providers will give a flu and a COVID shot in the same visit. So find a provider today at myturn.ca.gov. We've also posted a calendar of upcoming clinics at socoemergency.org/event/category/pop-up vaccine. Now I'm going to turn this over to our chief epidemiologist, that's Kate Pack. She will walk you through the latest numbers that we have. Kate, turn it over to you.
Thank you, Dr. Mase. Let me just share my screen. Okay. Right. So we're just going to briefly review what we're currently seeing in the county in terms of respiratory illness. First, looking at COVID-19, looking at our trends since June of this year to present, we can see that though cases have decreased, as Dr. Mase mentioned, to the lowest levels that we've seen in some time, we are starting to tick up slightly. As of today, there are about 6 new cases of COVID-19 per 100,000 residents. When we look at test positivity in overall Sonoma County, we see a level of about 5% as compared to about 6% in the lowest quartile of the Healthy Places Index. So that is those areas of the community that have the least resources to support health and well-being. Looking at our COVID-19 hospitalizations since June, we've also seen an overall decrease. As of today, as of yesterday's data, there were 23 people hospitalized with COVID-19. And looking since June, 24 individuals have passed away from COVID-19 complications. We do have wastewater surveillance active in Sonoma County. You can access this data at this web address indicated here, publichealth.verily.com. We have wastewater surveillance in Santa Rosa and in Petaluma at this time. Similar to the trends that we see in COVID testing data, wastewater surveillance indicates an increase in the presence of COVID-19 in wastewater samples in both communities. And we continue to track COVID-19 variants. BA5 and BA4 subvariants are remaining the most dominant variants that we're seeing in Sonoma County. We have detected BF and BQ subvariants that you may have heard of in the news. While these new subvariants are more transmissible, they have not been shown to be associated with more severe outcomes from COVID-19. Turning to influenza and RSV, it's important to note that our ability to track influenza cases and RSV cases differs from COVID-19. So these are not reportable illnesses in the same way that we would have a count of all influenza or RSV cases in our county. However, the state does track influenza through surveillance sites that are located throughout the state. And they track over time each year the percentage of specimens that test positive for influenza and during different weeks throughout the flu season. And as you can see here in this blue colored line, which is this year, we are having an earlier and higher start to the influenza season. So we're at a higher point this year in terms of the levels of influenza being detected at these surveillance sites than we've seen in prior years. You can see a similar trend with RSV in terms of higher and earlier levels of RSV detected than prior years. When we look in our wastewater surveillance locally, we can also see increased levels of RSV and influenza in both Petaluma here in the dark blue and Santa Rosa in the light blue. We are also able to track local hospitalizations for influenza. This slide shows since October, numbers of individuals hospitalized each day for COVID in yellow and influenza in blue to present. This top chart shows the number of these patients who were in the intensive care unit, blue representing COVID patients, the pink influenza. And so as you can see, hospitalizations and ICU stays for influenza have increased since flu season began in October, and we're currently averaging about 20 individuals hospitalized for influenza per day. Looking at our bivalent booster administration, so these are the boosters that are designed specifically for responding to Omicron variants. The proportion of our eligible population in Sonoma County who've currently received the booster is about 21%. This is higher than what we're seeing statewide in terms of the proportion of the population receiving the booster, which is 13%. When we look at who's receiving the booster locally, we can see here in this chart by age, looking at distribution across age groups, we can see that the majority of the boosters have been received by the 65 plus age group, over half, 52%. The gray bar represents a proportion of this age group in the population. So we can see 52% of the boosters have gone to the 65 plus age group, which represents 22%. The next group that's received the most has been the 50 to 64-year-olds, and then on from there. When we look by healthy places index quartile, A greater proportion of doses has been received in the quartile 4, the quartile where individuals have the most resources to support their health and well-being, as compared to quartile 1, where 18% of doses have been received. When we look at the percent of those eligible vaccinated by race and ethnicity, we can also see some disproportionality with white non-Hispanic residents. 28% of those eligible have received the booster to date, as compared to 7% of those eligible among the Latinx population. And that is the end of my slides, and I'll turn it back to Paul Gullickson. Thank you.
Thank you, Kate. I really appreciate that information. Just to remind people that we will make these slides available after our presentation today. I now want to turn to Dr. Gary Green. He is our infectious disease expert and with Sutter Health, and a well-known guest on our health updates. Dr. Green, I'm wondering if you could start by just telling us what you're seeing in the community and with respect to respiratory illness.
Hi, Paul. Yeah, thank you very much for inviting me today. And hello, Dr. Mase. I appreciate your support. Yeah, in the Sutter footprint, Santa Rosa is seeing an extraordinary amount of a number of viruses. Our COVID numbers have not gone down, but they've also not gone up either. But it's hard to know what that means with home testing. Influenza has really taken a step. In the Sutter footprint, Santa Rosa has the highest numbers. So right now, out of hundreds and hundreds of flu swabs we've sent in, 43% are positive for influenza. That's an extraordinary number. Usually we think of the flu season as starting when your swabs are more than 10% positive. We've been at that level above 10% for about 3 to 4 weeks. And right now we're at 43%, and that doesn't look like it's peaked yet. Now, for the hundreds of swabs we've sent in, respiratory syncytial virus, or RSV, has 16% positive swabs, which is really an extraordinary number. Our hospitals have seen an uptick in influenza cases, but it's not overwhelming, certainly less than 10 in our hospital right now. But as each week goes by, we see a steady rise in patients who are coming in with influenza, and most of them are unvaccinated. So it's just really important, and I can't impress what Dr. Mase has said before. When it comes to COVID and when it comes to influenza, the one thing that really makes a difference in patient survival is vaccination. It's the strongest thing. With COVID, we're actually fortunate that Paxlovid and the other treatments we use for that can improve mortality. But most people don't realize that Tamiflu and the other antiviral medications for influenza can help shorten the disease by 1 day, but it doesn't improve survival. The only thing for influenza and the strongest predictor of improving survival is vaccination. So that's been a very important strategy in the Sutter footprint for our staff as well as for our patients. I think every single patient I see in clinic and in the hospital, I ask them about being vaccinated. Some decline, and that does make me a little bit sad.
Dr. Gann, it's really interesting. Can you give us some idea why it's so the respiratory the illnesses are so extraordinary, that why the flu season is so bad this year?
Well, we have a couple clues, Paul. We know that last year in the summer season, when Australia went through its flu season, they go through their flu season when we're in the summer. They had the biggest flu season they've had in 10 years. And the strain that was circulating in Australia was H3N2. The strain that we're seeing right now, most of the influenza is influenza A, like 99%. And 3/4 or more of that influenza A is H3N2, the same strain that was seen in Australia. The good news is vaccine seems to match. So vaccine matches both circulating strains of influenza A, H1N1 and H3N2. We haven't seen much influenza B, so there's not enough to really test that against vaccine. But there's no reason to think that vaccine won't hold up for influenza B as well. So we know that Australia had a big season. And even though the vaccine is positioned well, I think it's a bit of a culmination of a number of things. People in the public don't want public health measures. And so it's very common that whether it's at church, whether it's in the grocery store, or whether it's in schools, people don't want to wear masks. And we know that when you don't wear masks, you're not careful about hand washing, you're going to have spread of all respiratory viruses. We're seeing that this year. If you look at UCSS data, parainfluenza in San Francisco is even higher than influenza. So we see 4 major viruses, COVID-19 or SARS-CoV-2, influenza A, H3N2 mostly, RSV, parainfluenza. And that's not to say just the common rhinovirus, the common cold virus that's always circulating at 30% or more. Now, when people don't follow public health measures, when you're not washing your hands, when you're not wearing a mask, when you're not being careful about keeping your bubble small, when you're traveling through airports and through public transportation without taking precautions, you can expect to get sick. The one danger this year, Paul, is that we're worried that people are going to get co-infected, and we're already seeing that. I had someone in the office today with influenza A and with COVID, and that can be very dangerous if you're a very vulnerable, aged, or a person with multiple medical problems. The other interesting thing, Paul, which I think is fascinating, is there are lessons to be learned from the 1918 flu pandemic. In 1918, and actually, if Ted has it, I actually sent him a slide today. And if you could show that slide, Ted, that'd be great. In 1918, there were 3 waves of influenza in the first year. And this data is epi-data that comes from Europe in 1918. W1, W2, W3, those are the 3 waves that happened in 1 year of the novel influenza virus in 1918. But R1, R2, and R3, those other spikes, those are influenza that was seen in the subsequent years as it became more endemic. We're in the R3 phase right now. We're 3 years out. So we're still expecting that as Omicron has become endemic, that it's going to have these circulating spikes throughout the season. If you notice, the R3 is kind of a broad spike there, and we're seeing this broad period of Omicron strain, and now we're seeing BA.4/5 Omicron subvariants that are evolving over time. They're not evolving more resistance, but they are evolving slightly more contagiousness. So I think the pandemic of 1918 has kind of been a roadmap of how we've experienced the COVID-19 and the SARS-CoV-2 pandemic. Now, one of the things I'm sure that happened in 1918 is after the war, people were tired, they were traveling more, they were coming back home, there was less mixing of soldiers, but people were taking less precautions in the 3rd year after the pandemic. And that's what's happening right now. Kids are back at school, we're all traveling for the holidays, people are mixing in their bubbles, and I think we can expect all viruses to bump this year. And it's going to be a bit of a rocky respiratory season this year. And it's not due to one virus, it's due to multiple.
Yeah. Well, that's really interesting. I mean, clearly there's a lot of pandemic fatigue out there, and we're dropping our guard a little bit, but it's interesting to know we're still learning lessons from that 1918 pandemic. We feel like we've been learning everything that's been able to teach us. So thank you for sharing that. We have more questions for you, Dr. Green, and we'll come back to you in a minute, but I now want to turn to Dr. Jenny Fish, one of our community physicians, who's been a great help to this county and just in helping us understand what's really going out within community. Dr. Fish, what are some of the things that you're hearing from your patients and some of the misconceptions there is about respiratory illness out there?
Yeah, thanks, Paul. Good afternoon, everyone. So I do primary care here in Sonoma County at a federally qualified community health center, and there's a lot of concern and fear in the community because there's so many illnesses and so many people are sick, especially children. There's a lot of fear of children being impacted. As many of you may or may not know, most of the children's hospitals across the country right now are full from RSV and flu. And so that kind of has some backlog. So I know that the Children's Hospital of Oakland, for example, is full. We've had multiple children from Sonoma County get hospitalized. Some here, but most of them get transferred to Sacramento or to San Francisco. And so there's a lot of fear. I think all of us have kind of forgotten what it's like to have all these viral illnesses during the winter times. Normally, kids can get up to 6 upper respiratory infections a year, and that's normal. It doesn't mean anything's wrong with their immune system or anything else like that. But right now, there's so many that are circulating, as Dr. Green had said, and they're circulating earlier, and they seem to be stronger. So kids are getting more sick, people are getting more sick. And I think over the last couple of years, because we've done so much masking and taken the COVID pandemic precautions, we haven't seen that as much. And so now that we don't have generalized masking, more people are sick. I have more of my vulnerable patients, my elders, and the babies that I take care of that are getting exposed. And are facing much higher risks. And so right now, the general risk to our most vulnerable in our community, including essential workers, including children, including our elderly, the risks are significantly higher. The other thing that I'll just throw out there is that, you know, a lot of clinics are dealing with understaffing similar to the hospitals. There aren't as many appointments to call your doctor and get in to be seen as many would like, as we probably need. Urgent cares are full, the ERs are full, the waits are hours and hours. And so people are really stuck wondering what to do. And there are some great resources for some people. I didn't get a chance to send this table to Ted. I don't know if I can share my screen really quick, but I wanted to show one quick table that comes from the American Academy of Pediatrics, and it really kind of tries to simplify the difference between flu, COVID, RSV, or the common cold in terms of symptoms. It might be a little bit more complicated than this. As a doctor of 2 children that currently have influenza and had a cold just before that, it gets confusing. But this type of resource can help families and help parents kind of know when you actually should go to the doctor and when you should go to the ER. In terms of, and maybe we'll get into the, like, warning signs and all of that, but healthychildren.org has some really good resources for families to help you know when to call your doctor. And, you know, the last thing I'll just say, Paul, is that a lot of people want to know what it is they have, right? Pre-COVID, for the most part, we never really cared so much. We didn't investigate or try to diagnose so much unless somebody was in the hospital or was so ill that they needed to be admitted. And so now we all just really want to know, because we're wanting to know if it's COVID or is it RSV. People are very scared of RSV. But the truth is, you know, you can care for yourself at home for the most part, and people that are really not doing well and people that are having respiratory distress or babies that aren't doing well, those should be the folks going to the ER. I wouldn't suggest going to the ER just to get a diagnosis. Unfortunately, you can't get a flu test, a home flu test from CVS like we can for COVID. But I would just say, you know, try not to go to the ER unless it's really, really necessary, and you're really not doing well or your kid isn't doing well. And a lot of clinics are trying to do telephone assessments. So.
Yeah, that's hard. Well, if we could get into it a little bit, Dr. Fish, what are some of the real warning signs that parents should be concerned about, and when they should step up and go to the emergency room, maybe?
Yeah, I think it's a really important question, Paul. And I was actually just talking with a lot of the promotoras and community health workers today about these very signs. And the graphic that I showed that I can share with you all to put on the site really kind of details it out. But there's 3 things that I think are really important. One is respiratory distress. And so when children aren't actively coughing or crying, if they need to use their whole chest muscles or their neck muscles to be able to breathe, you need to go to the ER. If a child is lethargic, not waking up to eat, not able to stay awake, that is more concerning. Hydration status is really important. So especially when kids are having fevers, this is true for adults and elders as well. If people aren't taking in enough fluids, they can get really dehydrated and get really sick. And so the way we see that is your mouth can be very dry. You know, kids that are really dehydrated, when they cry, they don't have tears. And you know, those are warning signs. The other one is fever. And so most people can take things like ibuprofen and Tylenol. they're okay to take together. Tylenol, we tend to dose every 4 hours. Ibuprofen, we tend to dose every 6 hours. But if kids have fevers of 104 or higher that don't go away, even though you're giving the appropriate doses of those medications, that can also be a cause to need to go into the ER. Those would be the ones that I would say off the top of my head.
Thank you very much. That's really valuable information, Dr. Fish. We have some. We're going to get to some questions from our audience members now, so I just encourage everybody, if you have thoughts on a particular question, I'll direct them to certain panelists, but please feel free to jump in if you have a thought to share. I also want to let our viewers know that our Q&A function is not working today if you're on the website itself, if you registered the webinar, but please feel welcome to. The easiest way to send us questions is by emailing to public affairs at sonoma-county.org. That's public affairs, it's one word, at sonoma-county.org. Or if you are following us on Facebook or YouTube, just post your question in the comments area, and we have staff following as we go. We're going to start with a question from Elizabeth F., who has a question about RSV, and she says she owns and operates. She says, I own and operate 2 large preschools in Santa Rosa. I care for about 200 of our county's 2 to 5-year-olds. She says this last few weeks have been the worst I've seen in the past 30 years, and not just my schools, grade schools and other preschools also. What I would like is clear guidance on how to know when kids have this RSV, how long they need to be out of school, and most importantly, how to stop or slow the spread. Dr. Green, do you want to start with us on that? As she had 3 questions, how to know when kids have RSV, how long they need to be out, and most importantly, how to stop or slow the spread in that kind of a setting. Do you have thoughts on that? And Dr. Fish, I'll be interested in your thoughts too.
Yeah, I'll be brief because I think Dr. Fish has good experience in the pediatric arena. But RSV in children is like a cold, but then it gets really bad. It gets severe. And oftentimes there's a lot of copious secretions with RSV. It's like a bad cold, but it's not like the flu. They're a little bit different. RSV kind of ramps up over time, where the flu hits you like a brick. I will say in adults that adults can still get RSV, and adults over 65 have a tremendous mortality from RSV. So just like the flu, we want to be careful about adults and the frail elderly getting RSV. And in adults, it presents more like wheezing. It's kind of like asthma in someone who doesn't have asthma in the elderly. But I'll let Dr. Fish comment on in the pediatric arena.
I think the thing that I would add as somebody that has to write a bunch of notes to let kids go back to school is pre-pandemic, pre-COVID pandemic, I would say the guidance that we were giving is really kids can return to school after they've been without a fever for at least 24 hours without the use of medications, and overall are symptomatically getting a little bit better. As you all know, when we get viruses, respiratory viruses, the cough that can linger for some kids and some of my patients, I used to tell them a month, up to 6 weeks, right? That cough can actually be pretty persistent. And so if we told kids not to go back to school until their cough totally went away, they would never be in school from about October until April, probably. And so for and I think Dr. Mase can speak potentially to kind of just the policies or recommendations to standardize it in terms of across all school districts. But my recommendation as a primary care physician is to wait until they haven't had a fever for at least 24 hours without medications, and then are somewhat getting better. Their cough should be getting better within, 5 to 7 to 10 days. And if they're doing better and kind of playing and eating and engaging, like usually they can go back to school. The other piece that I would just say in answer to the question, Paul, is how to stop or slow the spread. I would very, very strongly recommend that parents send their kids to school with masks. Masks make a huge difference. Obviously, hand sanitizer, like throughout the day, in and out, like before they eat, like not touching their faces and all of that. But masks really can make a difference. It doesn't solve it. And if only a few kids are wearing masks, it's not going to protect them. But if most kids are wearing masks, and if the teachers teaching them are able to wear masks, that's going to reduce the spread to the teachers too, who can also get these viruses and then are out. And schools are also dealing with understaffing, I would imagine. So I highly recommend masking for everybody, especially anybody that has anybody vulnerable in their families. Or school-age children.
Well, we certainly know how to wear masks, and we know that they should still be around. So I think that is really good advice. Actually, that's a good segue to our next question, which I'm going to direct to Dr. Mase.
Paul,
Yes,
is it okay I just wanted to
absolutely. Yeah.
totally reinforce what Dr. Fish just said. The public health guidance that we've been giving to parents and to schools that have been calling us are exactly what Dr. Fish said. We're not looking for every child or every student to get tested for daycare and school. That's not what we were doing prior to COVID, as Dr. Fish mentioned. But the schools and daycare should follow their respiratory illness guidance. Everyone should have some sort of protocol. But in general, if the symptoms are improving and they haven't had a fever within 24 hours without taking a Tylenol or ibuprofen or some fever reducing medication, then they could return back to school. And we certainly are recommending that the students wear masks and good hand hygiene and all the things that Dr. Green went over. But exactly what Dr. Fish said, that's what public health is recommending this year too. For COVID though, if possible, we really would like a negative COVID test, because there are some isolation recommendations and guidance around COVID, but we're not recommending every student go to their provider. We know that they're over capacity already, and it'd be very difficult to get all of those students in to get tested and be negative before going back to school.
That's great. Thank you very much, Dr. Baldwin. In fact, that was one of the questions from one of our media partners, Telemundo. They had asked, what are the recommendations to the community from the county to prevent getting these respiratory viruses? It sounds like we've covered a lot of them. Dr. Mase, is there anything else you wanted to include in that? Certainly you're strongly recommending masking.
Yeah, I would agree with everything that's been said so far. As Dr. Fish said, masking is probably one of the best ways to prevent transmission of these respiratory pathogens. And that you can see, because the last couple of years, when we have been following COVID protocols, having everybody masked, we haven't actually seen much influenza, or for that matter, RSV. And so I think that really speaks to the fact that masking works and it's very important. It's a high recommendation for all schools and other indoor public settings, especially if you're worried about your situation, somebody that you live with, if you're concerned that you could have negative outcomes. Now, large gatherings, especially in indoor settings, travel, all of these are also associated with a risk for getting a respiratory illness. So I think people have to kind of look at what their circumstances are and understand that it's really important, if they want to protect themselves and others, to follow these simple mitigation measures. Vaccination, of course, is first and foremost. As you know, the COVID bivalent booster is available to anybody who's not had a COVID shot in the last 2 months. It's available. We have lots of it in the county. So please get your COVID booster. Influenza vaccine, which has been around for a very long time, for many, many years, is a great way to prevent severe complications of influenza. So I highly recommend that as well.
Yeah, and as was mentioned earlier, the county, we have reactivated our calendar, which shows the available clinics each day for both the boosters, the COVID vaccines, and for flu vaccine, where those are available in the community. So please check that out. That's on socoemergency.org. You can also go to myturn.ca.gov. That's myturn.ca.gov, and you can find out where appointments are available in the community for both flu and COVID vaccinations and boosters. And they'll also show you where some walk-ups are available in the community. I now want to go to another one of our media partners, Phil Barber from the Press Democrat. Phil, can you hear us?
Yes, can you hear me?
Yes, thank you for joining us.
Yeah, thanks everybody for your time. I had a couple questions. It's been said here, and I've heard it elsewhere, that local emergency rooms are filling up, and maybe even some have been at capacity at certain times lately. But I haven't heard gotten any hard information on that. Dr. Green, can you tell me if Sutter Santa Rosa's ER is near or at capacity? And Dr. Mase, have you heard that about any other hospitals in the county?
Well, I have good news. So Sutter has actually extended its ER. So our ER has grown in bed capacity, which has been great because for the longest time, we were using a tent outside of our building. We're starting to use the tent again, but with doubling our ER capacity, we're able to see twice as many patients. And that's really been an important decompressive thing. What I really noticed was, in addition to our ER being busier, but not over capacity, just the number of calls coming into primary care and to pediatric offices has been really overwhelming. It's really, our phones and our messages have been extraordinarily busy. And I think it just represents a lot of parents who their kids are sick and they want to know what to do. And they're concerned about if the illness could get worse, and we're giving them advice on what to watch for. I think what Dr. Jennifer Fish shared earlier about what to watch for with children is really key because, you know, some people haven't been parents and some of us don't take care of children. And a child can get sick pretty quick, but at the same time, most children don't.
And I can just add that I've heard the same from Kaiser, that they have actually erected some tents outside in order to take care of any kind of emergency department overflow. Their volumes in the emergency department are definitely up with respiratory illness. I have not heard from Providence or Memorial at this time, but I don't know, Dr. Fish, if you know anything more.
No, I mean, the sense I get is that here in Sonoma, our ERs and our capacity are okay. I think the big issue comes from when when kids have to be hospitalized, oftentimes they're transferred out. I spoke with a physician who is working at CHO, the Children's Hospital of Oakland, and they have nowhere to transfer kids to. Their beds are totally full. And so they're basically like running an inpatient pediatric unit in the ER, kids that need to be admitted, but they don't have a place to send them to. They're just waiting for people to get discharged from the hospitals. I've also heard from other pediatric hospitalists across the country that I know personally who are describing this as like a surge, kind of like the COVID surge that we had for adults in 2020. This is what pediatric hospitalists are experiencing across the country right now. That's not the case right here in Sonoma County, but most kids that get hospitalized in Sonoma County get transferred out anyway. I know Kaiser and Memorial both have some pediatric beds and might be talking about expanding them, but I don't actually know that.
That was really helpful. I appreciate it. Can I ask one quick question?
Sure, go ahead, Phil. You have a follow? Yeah.
Yeah, thank you. I just wanted to double check if Kate's still on. Kate showed a chart that showed a pretty steep spike from wastewater surveillance for both influenza and RSV. Are there any numbers you can attach to that, Kate? Do we know what those rates are in Santa Rosa and Petaluma?
So the wastewater surveillance is really looking at kind of like particles of the illness that's detected per unit of wastewater. So it's a little bit difficult to describe in numbers. It is on the side of the chart there. I can send you some more resources, maybe offline for interpretation, if that would be useful. If you go to the Verily site that's linked to in the slides, they also have some information on there about how to interpret the graphs.
That's great. I can find that. Thanks for that guidance.
Okay, thanks.
This next question, I'm going to direct to Dr. Mase or Dr. Baldwin. Kelly writes in, I have a 4-year-old who has symptoms of flu and RSV. She had COVID over Labor Day, so I don't suspect that that's what she has. She isn't seriously ill, so I have no plans to take her to see her pediatrician. However, she asks, does the county want her tested so they can have accurate infection rates? Do you want to address that, Dr. Mase or Dr. Baldwin?
Yeah, and let me turn this over to Dr. Baldwin.
As much as we love data and information, no, we're not recommending that you take your child into the primary care provider to get tested so that we have the numbers and the information. We know that RSV is going up and we know that flu is going up, and no, that would not be our recommendation. Go ahead, Dr. Mase.
Well, I was just going to add that, at this time, as you already heard from Dr. Green and Dr. Fish, there are long waits for the pediatrician and primary care providers, for emergency departments. If your child is not very ill and has a respiratory illness, you already know what to do. Keep them at home, make sure that they are well hydrated, that they, as Dr. Fish already gave you all of the symptoms or signs of severe illness, which would prompt you to take them to the doctor. But if they're not that sick, then it's better that they stay at home, don't infect others, and get through the illness. And we don't need to have that diagnosis necessarily for our numbers, given that we really want to allow our healthcare providers to be open to seeing really sick kids and other patients.
Can I add one thing, Paul?
Yes,
one thing that I would add is that that's the beauty of the wastewater surveillance. Even if it doesn't give us cases, it gives us trends. So we know there's a ton of RSV in the community. We don't need to know the actual numbers. The other thing that I would like to say just about the having COVID on Labor Day is that you can still get COVID again. And so especially with the Omicron variants, and Dr. Green and Dr. Mase, Dr. Baldwin, you can correct me if I'm wrong, but my understanding, we're seeing infections even within like a month or 6 weeks. We used to say 3 months, you were good, you had good protection, but we don't get as much natural progression or protection from the Omicron variants, and people can get reinfected. So I'm still recommending when people get new symptoms to retest for COVID. And one negative COVID test does not mean anything, basically. And so with the home test, you should test when you get symptoms, and I would test again at days 2 and probably days 2, 4, 5, or 6. Like my understanding is the data shows doing every 2-day testing for at least 3 tests is the best way to know for sure that you don't have COVID.
Actually, that is one of the questions. Our next question relates to that. I'm going to ask Dr. Green to weigh in here. How soon after getting COVID, presumably Omicron variant, can one get reinfected? What are you seeing, Dr. Green?
Yeah, I see it about 2 to 3 months. It depends on the patient. If it's a young kid, a 20-year-old, a 30-year-old with no medical problems, they're going to have a little bit more immunity. But I'm seeing middle-aged and elderly patients getting sick a little bit sooner. And we also know that your immunity from natural infection is not as good as your immunity from vaccination. So vaccination seems to have a better response than getting a natural infection from it. But in elderly patients, I'm seeing it within a month or 2. In college-age kids, 20-year-olds, 30-year-olds who are otherwise healthy, I'm seeing a little bit longer. And if they do get reinfected, it's usually not as severe.
Well, if we could take a step back here and just, we have another question that kind of relates to this, and that is, as Kate noted in the numbers, we're seeing about 21% of our population that's eligible for the booster has gotten the booster. Now that's far better than the state at 13%, but that still means 4 out of 5 Sonoma County residents who are eligible for the booster have not gotten it. In your estimation, why is that happening? Why are so few people getting this booster? Dr. Fish, what are you hearing in community?
I mean, obviously there's the concern and the question of why so many boosters and why so many shots. I think there's pandemic fatigue. People are tired about hearing about it and worrying about it. I think there's also lack of just understanding of the why. I think a lot of folks don't understand why we are recommending the vaccines. The bivalent booster obviously provides like additional protection against the current circulating variants of Omicron, whereas like the other boosters, it was the original virus from 3 years ago, and we know that the virus keeps changing. And so it actually offers more more protection. We also know that that's kind of how flu is. We get vaccinated with a different flu vaccine every year based on the current like strains that are circulating. So I think part of it's fear. I think part of it's just not understanding. Before the booster recommendations were kind of complicated. It was only certain age groups or certain people. Now it's totally simple. There's 3 things. You need to be 2 months out from your last COVID shot, whether it's the primary series or your last booster. You need to be 5 years or older, right? And it's super simple. And I think people don't know that. I think access is also an issue. So because of understaffing in clinics and in hospitals and in the health system as a whole, there's less funding from the federal and state governments. There's fewer people to give vaccines. And so I think people are also struggling to actually get the vaccines at their appointments. So I think that's the other reason that some people are struggling to get vaccinated. I've heard a lot of people want to be vaccinated against both flu and COVID and are struggling to connect the dots.
Dr. Green, do you have any other thoughts on that?
Yeah, Paul, I think there are 3 camps of people when it comes to vaccination: those that support it, those that don't, and those on the fence. And I think that pandemic fatigue is affecting people on the fence because they're kind of done with it. They kind of want to move on with their life. For many people, they think like the pandemic or the flu season is a bit of an inconvenience. And for those of us that work in hospitals and we see people die of both every day, and if you're a pediatrician and you see a hospital death from a pediatric case of flu or RSV, it really kind of changes you, and it makes you realize how important vaccine is. But I think the people who are sort of on the fence about vaccination are a little bit tired of hearing about it, and that's where the pandemic fatigue comes in. But once you have a conversation with them, and once I tell them that, my college-age kids, I've got them vaccinated, I drove to Arizona to pick up my mom to take her to Walgreens to get a bivalent booster because I just thought it was that important. When she goes to church every day and she says to me, "Mijo, no one's wearing masks." And I'm like, "Mom, but you need to," and she's very careful about that. So I think your conversation with the healthcare providers is going to be helpful to reinstitute that trust and letting them know we're also tired of the pandemic, but it doesn't mean you want to let your guard down because like driving on the freeway, you want to wear a seatbelt and you want to have an airbag. That's what it's like getting vaccinated.
It's a good analogy.
And can I add one other thing, Paul,
Yes.
is just to say that we know vaccines help reduce risk of hospitalization and death. We also know it helps reduce severity of illness, right? And so the people I know getting the flu and the people I know that have had bad COVID, they're miserable and they could be miserable for weeks. And if it can decrease that time and keep you out of the hospital, it's worth everybody doing. And like Dr. Green said, as physicians, we see the consequences. We see the real life consequences of people who are suffering because they didn't get vaccinated. And it does change you. And that's why we so strongly believe that everybody should do it, especially now with like all of the crazy respiratory illness that's happening.
Yeah, Paul, one thing that's really key this year is that unlike influenza, you don't hear a lot about long influenza, but we do hear about long COVID. And we know that vaccination lowers the risk and the rates of people developing long COVID, even if you have a breakthrough infection. So if you got vaccination and you still got COVID and it was a mild illness, you're much less likely to develop long COVID symptoms after a COVID illness once you're vaccinated. So there's a lot of benefits to it. And I think that's going to be really important in the backside when 2 or 3 years down the road, we're all looking back, kind of writing our memoirs about what that experience was like.
Yeah, and I guess I can just add from my perspective that, everything Dr. Fish and Dr. Green have said is true, but I want to just let everybody out there know that it is so important to get that bivalent booster. It's going to give you more immunity against the newer variants that we're seeing with COVID. So over time, the virus changes, and the vaccines that you got initially last year, earlier on, are not going to be as effective. So get this one. My personal experience, and I got the flu shot and the booster, bivalent booster on the same day together. It's better to get them together, get the pain and suffering over with, and it wasn't nearly as bad from my perspective as the previous vaccination. So please go out and get that. Again, everyone 6 months and older can get the flu shot. Everybody 6 months and older can get the initial series of the COVID vaccine. And anyone 5 years and older can get the bivalent booster.
Thank you for reminding us of that. I think the key messages here today are that the flu vaccine works, the booster works, and masks still work. Dr. Mase, we're at the top of the hour, but I have one last question I'm going to pose to you, and it comes from Anna from our viewing audience. She asks, is there a chance that a public health order would be issued for schools concerning masking, I presume? Your thoughts on that?
You know, I think it's a great question, and it's something that in public health, you know, we're constantly thinking about when we need to pursue orders. It's constantly in our mind. At this point, with the advent of the vaccines, the fact that we have these good vaccines, we're not seeing the dire consequences that we saw 2 years ago, 1 year ago, that is 1.5 years ago and 1 year ago. So I think at this time, it's a high recommendation. I'm going to continue to tell everybody that I think it's really important to wear a mask in public indoor settings, especially congregate settings where people are close together for long periods of time. I personally do wear a mask whenever I go into an indoor setting, even now, even though I see many people are not. At this point, the thought of another mandate would be something that we should take very carefully. If that's why we're following the data. You see us always looking to see, you know, what our COVID rates are, the test positivity, hospitalizations, whether we're seeing the negative outcomes. We will continue to follow those carefully and continue to weigh the need for such orders in the future.
Well, we're going to end our session here. If we had a number of great questions today, and if you did not get your question answered, please feel free to send it to us, email at us again at publicaffairs@sonoma-county.org, and we will get you the answer that you're looking for. But we want to thank all of our panelists for joining us today. This was really a great session. Dr. Fish, Dr. Green, Dr. Mase, Dr. Baldwin, Kate Pack, we thank you all for the information. I'd also like to thank the crew who helped put this together today, including Julie, our Spanish interpreter, and our 2 ASL interpreters, Julie and Holly. We encourage everybody, there is information, a lot of information on socoemergency.org/vaccine, where you can find out about how to get both the booster COVID vaccine, the booster, and flu vaccine within our community. And again, if you have questions, please feel free to email us at publicaffairs@sonoma-county.org. So anyway, for now, please everybody have a good week, have a safe holiday, and we'll see you again soon. Thank you.